My first immersion into the behavioral health system was by taking the job as the Maricopa County Public Fiduciary in 1979. As the public fiduciary, our office served people with mental illness, people with developmental disabilities, and the elderly, such that I was able to learn the needs of folks who fit those categories and create an advocacy process. Being a lawyer helped to be able to advocate and advance the needs of people with disabilities. I have a sister who is profoundly disabled. My sister was developmentally disabled, placed in institutional care at age 2, and going to visit her in a day program where she was able to learn basic socialization skills was affirming to me and taught me that there essentially are no limits to people with disabilities, that limits that we as a community purport to impose or believe exist don't. And I've experienced that personally, I've experienced that professionally as the public guardian, and I've experienced that as a person, as a human being. So I feel blessed to do the work I do. Again, being a lawyer helps my advocacy by simply giving me some extra tools to use as an advocate. The same groups of people that we served at the Public Fiduciary's office were not being served privately in our community. And so when I left the Public Fiduciary's office in 1981, I went back into private practice, this time as a mental health lawyer. I describe my practice then and now by virtue of the people we serve, people with mental illness, people with developmental disabilities, and the elderly. So unlike other lawyers who would identify their practice by virtue of the work they do, bankruptcy lawyer or a divorce lawyer or a personal injury lawyer, our practice is defined by the people we serve, and I think that too is a blessing. I've also found a way of being a lawyer and still being a nice person.